Well, hello, everyone. Happy Saturday. Welcome into the room, everyone. As people are getting their audio connected, I want to say happy Saturday and welcome to the virtual career day sponsored by Johnson & Johnson, hosted by the National Black Nurses Association. I am your moderator today, Tiffany Gibson, owner and founder of New Nurse Academy. I am a truth teller and I love to talk and educate, and I like to shake things up in nursing. So I teach nurses how to use emotional intelligence to critically think, to be change agents, culture pushers, and leaders in nursing. And today I have the fabulous opportunity to talk to these nurse trailblazers who are in different various points in their nursing career to talk about how they got there, what they do to sustain it, and also talk more about the National Black Nurses Association. But before we get started, I'd like to say greetings to Dr. Martha A. Dawson, President of the National Black Nurses Association. She's going to greet us with a couple of words and talk to us about career in academia. Hello, Dr. Dawson. Happy afternoon.
Hey, I'm doing great. How are you?
I'm well. So I see that yes, I see that you are associate professor and scholar at the University of Alabama at Birmingham. And so can you tell us a little bit about that and having a career in academia?
Well, yes. First of all, I'd like to welcome those that are on the call at this time. Thank you for joining NBNA, our real talk about your career. We are so honored to be able to speak to you today. So as an academician, working in academia is a little different from working in practice sites. First of all, I spent my career, I would say, I just have to date myself, my first 30 some years actually working in hospitals. And also during that time, I started out as a cardiovascular nurse, working in an intensive care unit with open heart patients. Then I became a charge nurse, eventually a nurse manager. And from there, I went back to school with the intention of a cardiovascular CNS. I did complete the requirements for that, but I never did sit to take the exam because about midway through my program, I was tapped to become the nurse manager. And then I found out that leadership was really my true calling. So I did that for many years as a nurse manager, a nursing director, then an associate chief nursing officer, a chief nursing officer, a VP of clinical operations. And then I stepped out and I did my own consulting company for a while. And from there, I then started teaching full time. But all along the way, I was an adjunct faculty. But even being an adjunct faculty doesn't really tell you what an academic environment is truly like. I had to learn that, and don't take this the wrong way, but they love for you to write about yourself. And they also love for you to write about other things like doing a lot of publications, but I had like a 10-page CV, and now today I got like a 35-page CV because they want you to talk about every time you presented, every time you wrote an article, whatever you've done, they wanted to be a part of your CV. But what I really like about education, at least for me, I was able to enter education in the space where I was comfortable. What I mean by that is that I teach graduate and doctoral students in the Nursing and Health Systems Administration track. And I've also served as the director for that track. And I've also served as the coordinator for the Nursing and Health System Administration. So I would say, first of all, if you're going to go into academia, you need to have a focus. Whether that is going to be pediatrics, whether it's going to be neonatal care, mental health, but you need to have developed some expertise in some area of specialty. And so that's what I like about being able to teach what I know and to teach what I have lived because I'm comfortable with that. So I enjoy teaching things such as human resource management, financial administration, teaching people how to do budget, how to understand things such as what is a really good operating budget? What do you mean when you say that you have an income statement. And how do you look at that income statement? What does it tell you? How do you do a staffing plan and then project dollars? A lot of people don't like that kind of stuff, but I promise you I can make it fun if that's where you want to go. And the other thing about being in academia is that they usually say that you're going to have at least 3 focus. You're going to have a service focus, and then you are going to have a research focus or either a scholarly focus, and then you're going to have the teaching aspect. And so most schools will tell you, you know, you can't be an expert in all those things, but they want you to at least select 2 things that you're truly going to focus on. So most of the time when you're moving into academia, you're going to start off at the lowest level, which is generally an instructor. From the instructor, you're going to usually then have an opportunity to begin to build your, again, your CV or your dossier, as they call them sometimes, so that you can prepare to become an associate professor. In today's academic environment, if you only have a master's degree, the only thing you're going to be able to do is to teach as an instructor or as what they may call a clinical professor. You usually have to at least have a doctorate degree, whether that is a DNP or ED. It can be a MPH, it can be a PhD, but at least doctoral preparation in order for you to move into that assistant professor slot. Excuse me. Okay, clear my throat a little bit, see if I can sound a little better. But with that being said, once you become an assistant professor, there's certain steps and certain things you have to achieve. Sometimes that may be you have to have a clear scholarship focus. And then you have to make sure that you're writing and publishing and speaking along that particular topic. And then you go up for associate professor. Now, remember, I told you all that I grew up in the practice environment. So when it was time for me to get evaluated, I was evaluated on my outcomes. A lot of time those were 360 degrees outcome. But I can tell you when I did my so-called packet or dossier to go up for associate professor, it was like a 3-ring binder. And I'm sitting there going, how in the world can I talk this much about myself just to get a promotion? But that is the world of academia. So you have to, regardless of where you are, you're going to have to fit into that space and understand what are individuals looking for in order for you to progress your career. Now, my scholarship and research focus is really on career mobility barriers. I love helping nurses to look at, so what are those obstacles standing in your way to keep you from achieving and keep you from being your best? And so by looking at that and beginning to understand, and I surveyed close to about 300 and some charge nurses, trying to understand why did they not want to move beyond that charge nurse level and get into the director or the CNO level. So some of the things that I found out was things such as, well, you know, yes, I keep educating all of those other individuals that come in, they become charge nurses, they become head nurses, but then we don't have the mentorship or the sponsorship that others have. You know, and what do I mean by sponsorship? That is that person that is in a critical senior level position within your organization that is willing to invest in you and get you in front of the right people so that your talent can shine, you know, so that other people can see what you can bring to the table and understand what you're already doing. Now, mentorship of those focus more on helping you to develop the correct skill set and the tools that you need in order to elevate yourself to that next level. And so in academia, they also have what they call new, you know, incoming professors, and then what they call, you know, young professors and new faculty members and junior. Now, one word I do not like was junior faculty member, because remember I said that I had already been practicing for about 30 years. So, you know, here I go into a school of nursing and someone is referring to me as a junior faculty member. Now, I was real nice and professional for the first 2 or 3 times, but by the 3rd time I had to explain to them, I haven't been junior anything since I left high school. Okay. Now I did it very professionally, but I had to let them know they were not talking to a little green nurse, that I had experience under my belt. And I wanted to be recognized for that experience. Because by the time I got to academia, I already had I had been an administrative nurse fellow with Robert Wood Johnson. I had been an administrative fellow with Johnson & Johnson Wharton program. I was a fellow in the academy, well, not the academy, but a fellow in the College of Healthcare Executives. Now that's the highest level fellowship you can get in hospital administration. So you can imagine I did not feel as if I was just a junior faculty. And to me, that's out of respect. You know, no more than I would say to someone who's been, let's just take Dr. Marcia Lowe, who's sitting here tonight. I would not refer to her as a junior anything. She's been out there doing things. She has her PhD. She's out there, she's working, she's been making a difference for a long time. You know, she's been a president of one of our local chapters, you know. Or if I go over and look at Dr. Scharmaine, I would not refer to her as a young nurse. She's a doctor out there running an independent practice. So we have to be respectful of where people are and not say, well, because you haven't been in academia, or if I left academia and went back into practice, someone would think that I'm starting all over in practice. You know, so I would say to those who want to eventually get into academia, first of all, build your skill set. Know what you're good at. Identify what you love, and what on your worst day, the next morning you will wake up all excited about it, you know. Because in my young days, I had applied to school to become a nurse anesthetist. And when they told me I needed one more chemistry course and I could get in the next semester, I left the conversation, made sure that I just stopped right outside the school, sat on the steps, and I said, get real, Martha, that's not you. You cannot just pay attention all day long to a ventilator going up and down and something saying beep, beep, beep. I'm an action person. I like to get in there sometime and roll my sleeves up. You can't do that when you're trying to monitor a patient and make sure that they're breathing. You can't be in the surgeon business, and I know I would have been trying to do that. But seek out mentors and other people that have already gone that route. Listen to them. Some people will tell you what you don't want to hear, but what you don't want to hear sometimes is the most important pearl that someone will give you along your career journey. So thank you, and I hope to come back and answer some questions.
Absolutely. Thank you so much for your pearls and your words of wisdom. Truly appreciate that. And yes, it's a respect thing. You're not a junior anything, so I definitely understand that and can respect that. For those of you who have been coming into the room, welcome to the Virtual Career Day sponsored by Johnson & Johnson, hosted by the Black Nurses Association. Just going to remind you all to keep yourself off mute, but I also hope that you have a pen and paper beside you and you were writing down these nuggets that these amazing nurses are giving you. Also, feel free to write your questions in the chat and we will get to that later on. So next, I would like to talk with Dr. Marcia Lowe, who is the second vice president of the National Black Nurses Association. She is a nurse educator and a staff development specialist at the Birmingham VA Medical Center. So Dr. Lowe, I don't know if you remember me, but like 2 years ago at the last in-person conference, I came up to you, you did a presentation and I loved it. And I came up to you at the end to ask you for your slide deck, and you gave me your email and I asked you for your slide deck later. And then we spoke a little bit about the DNP versus the PhD, because I felt like I needed to have one as a nurse educator and staff development specialist myself, but just didn't know which way to go. And I just enjoyed listening to you talk, and I enjoyed your words of wisdom. So thank you. As one nurse educator to another, I definitely have been watching your moves from a distance, and I appreciate that. So I want to say welcome. And can you talk to us a little bit about the pathways to nursing education and staff development, and how we can do more than just be at the bedside?
Okay. Thank you, Miss Tiffany. That's a great intro, and I appreciate that. And I'm glad that I made an impact, because that's my intent when I talk to young nurses, future nurses, to make a good impact and make sure you're encouraged to go on and do other things. So as Tiffany said, my name's Dr. Marcia Lowe. I'm the second vice president of NBNA, and I'm so honored to be a part of this NBNA Health Fair today. It is very, very important, and I'm just loving the interaction and the energy. So I'm a nurse educator at the VA in Birmingham, and I don't think that's where I intended to end up, Tiffany, but that's where I ended up. I've been a nurse for about 38 years. I've been a nurse educator for about 20 years. I started off as a nursing assistant, and then I went on to Tuskegee Institute to get my bachelor's in nursing. And then from there, I came out, I started working med surgeons. As Dr. Dawson has said, you've got to have those basic skills before you move on, I believe. And so I did that. I worked in PACU for a while. I also thought I wanted to be a CRNA. I thought about it a couple of times, but that was not the path that I chose. So I worked PACU. I worked in disease surveillance at the health department, and that would be wonderful right about now with this COVID going on. But that wasn't for me either. And so then I moved on and I started working in ambulatory surgery. And I worked there a good long while. And then I decided I need to go back and get my master's. And I went back, got my master's in nursing education. And I worked and kept working and worked as a nurse coordinator. And then I said, well, can I go on and get that PhD? And yes, I did. So I went ahead and did that while I was working as a nurse educator where I am now. I finished up. It is not an easy path. It does take a lot of time, a lot of energy, but you know, the future of nursing really depends upon having people who are there to support our novice nurses who are coming out. And that's what I do on a day-to-day basis. Most of what I do is I'm with the orientees and preceptors, the nurses on the floor, planning CE events, those types of things. It is challenging, but I love it. Nursing is my passion. It's not just a profession for me. It is a passion. To be a nurse educator, you need to have a master's. Some places you can get away with having just a bachelor's, but most places require that you have a master's degree. And then, of course, you go on to get a doctorate. And I encourage all the nurses on today to finish that bachelor's. If you got an associate degree, go ahead to the next step. Finish the bachelor's degree. We're here to help you. We're here to support you. And then just don't stop there. Get your master's. Keep going. And then get a taste of that and then get your doctorate. Just keep going until you cannot go anymore. Just learn all you can. Some of the things I want to tell you about nurse educator skills that you need to be a good communicator. That requires that you're an active listener, you give positive and negative feedback, you are in tune to people's learning styles. You have to have a variety of interpersonal skills. There's always some kind of conflict resolution, and you want to rebuild relationships and build relationships. Be professional at all times. Professional dress, represent professionally, have professional tone. You can't always let your feelings show, and you can't carry your feelings on your shoulder. Be a leader, exhibit great leadership skills, be adaptable, influence others, and main thing is develop staff. Have that knowledge and expertise in a variety of areas, clinically and non-clinical. You must have the appropriate education. I've already said that. It usually requires a master's degree. Also, educators work as wound nurses, diabetic educators, dialysis educators. So there are a variety of areas you can go into. Teaching skills. You have to know those core competencies. You have to be able to know your audience. You have to be able to present in different manners, whether it's role play, PowerPoints, online courses, use of technology. You have to have those skills. Work with others, and there are a lot of people you have to work with, and then have a love of nursing. You know, speak positive about your profession. This is a great profession. Requires a lot of skills. This is a great time to be a nurse. All I can say there, the sky's the limit. And then I want to leave you with this. This is the 50th year for the NBNA anniversary. We still have our 50 by 50 membership campaign going on. You still have time to recruit members. You have until May 15th. So we need you to get out there and recruit. Again, I'm so excited about the day. If you have any questions or you need to just talk to me, just email me. I'll put my information in the chat box. I'll be happy to talk to you just to give you some encouragement. Even if I don't know what we're talking about, I'll give you some encouragement. Thank you.
Thank you, Dr. Lowe. Thank you so much. And so I'm a little partial to educators because I am one.
Yes.
But I really strongly agree with you about speaking positively about the profession,
Yes.
especially as an educator, because there are things that we sometimes do not agree with, but we have to teach on, and things that we have to do due to organizational goals. And educators are influencers, right? We're literally setting the foundation to your career. And so if you're choosing the career to be a nurse educator, whether in the academic role or in the staff development role at the hospital, that is a very important job, just as important as the administrators and as the managers, because we're helping putting the pieces, the clinical pieces together, helping you with skills so you don't kill anybody, but then also helping with QI projects as well. So you have to always think positively and revert to your why. I like that. So thank you so much, Dr. Lowe. Appreciate it.
And I do want to remind you guys that I'm going to need somebody to take care of me. So that's why I push on, and I want some skilled nurses.
Yes, thank you. And so next, I would like to talk with Miss Brianna Charles, the student representative of NBNA. She's also part of the board of directors. And so Miss Brianna Charles is currently in school. She's part of the NBNA Student Connect program, where we encourage student nurses and NBNA members to enroll in the collaborative mentorship program. So hello, Brianna, how are you? Happy Saturday.
Hello, thank you for the warm welcome. I'm doing well. Hope you're doing well as well.
Absolutely.
So I guess I can go ahead and introduce myself. So my name is Brianna Charles, like she stated. I am a junior nursing student at Howard University, and I also serve as the student representative on the board of directors for NBNA. Being a student representative on the board, I am basically like the voice for the students. I'm able to represent you all, us all, and serve as a liaison and really just make sure that the students' voices are heard and relaying the different concerns that we may have. So I really want to emphasize the importance of feeling comfortable enough to reach out to me if you guys have any concerns, anything that you'd like to suggest for the NBNA. We always are looking for ways to improve and to better serve our student members as well. So please feel comfortable enough to reach out to me. I will put my email in the chat box in case anyone wants to reach out and email. And I also want to speak a little bit to the NBNA Student Connect program. So I think that's definitely something that you all should take advantage of. It's really there as a resource to help you all. Really, like with NCLEX prep, anything really, it's really going to be a community to bring a bunch of nursing students together. So I really do encourage you all to participate in that when it launches. It will be launching very soon. So please check your emails when the NBNA announcements come out. And yeah, so it's going to be a Facebook group. And we're going to be posting updates on Instagram to the NBNA Instagram as well. So just keep up to date with that. And I really do look forward to seeing you all in that group, in that program, and connecting more with you all. And like I said, please always feel free to reach out to me if you guys have anything, any concerns, or you just would like to connect to another fellow nursing student. I'm here for that. So thank you.
Thank you, Brianna. So now I want to ask you real quick. Don't put yourself on mute yet. Hold on. When are you graduating?
So I graduate next year, May 2022.
Yes.
So I have one more year of nursing school.
Yes. And what are your nursing career goals?
So I'm interested in women's health nursing. So my long-term goal is to be able to open up a women's health clinic in an underserved community. I come from an underserved community, so that's where I want to give back, especially to Black women. So that's my focus.
I love it. I love it. Thank you so much. And congratulations already. I already claim it. I already claim it for next year for you. So yes, congratulations. So next, I would like to talk with Miss Tamijka Shinholster, Miss LVN MBA, which I actually love that combination, right? Because there's so much controversy about the LVN LPN nurse. And so I love that you are an LVN and also have your master's in business administration. So just to give you a little bit of background on Miss Tamijka, she is a graduate of Faulkner University, where she has her BA and her MBA. She received her LVN from Wallace College. Tamijka is an experienced leader with a demonstrated history of success in the hospital and healthcare industry. She has supported a variety of businesses, including Medicaid, healthcare management, managed care, and Medicare. Currently, Tamijka leads product management operations for Care Allies, a provider service. And right now, she's going to talk to us about nurse in operations. So hello, Tamijka, happy Saturday.
Happy Saturday to you.
How's it going?
It's going well. Absolutely wonderful.
So tell us a little bit about your career journey in nursing in operations, because that's also something that we don't hear about as far as nursing in different careers in nursing. I personally think that nursing school is getting nursing students prepared to work day shift hospital. Right? And past complex. And so I love that the panel is an array of different fields and areas in nursing. So please tell us a little bit about your nursing history and nurses in operations.
Absolutely. Thank you so much for your welcome, Tiffany. So I have been a licensed practical nurse for 27 years. My career started out med-surg, ambulatory surgery, and way back then, we, contingent on where you were, LPNs were allowed to dibble and dabble in other things. So I do have, I have learned intensive care background as well. I've had the opportunity to work as a prescription benefits manager, so a PBM coordinator for ACS Healthcare in Atlanta, Georgia. My military affiliation, led me to have to move quite often. And so about 15 years ago, I moved to Birmingham, Alabama, and landed a position with Cigna. And started out there as an LPN nurse coordinator, reviewed services, that included referrals, surgical services, and making determinations on whether they were medically appropriate or not. And that was a great role, for me. It was Monday through Friday, 8 to 5, how many LPNs, were afforded a position, afforded an opportunity to have a position like that. But after about 4.5 years, I started to get weary. I really wanted to pursue other things. And, but for whatever reason, I could not seem to compete with some of the other nurses. And so I started to ask, my leadership, how can I, progress? What do I have to do? And I was told, quite frankly, that, you need more education. Okay, so very hard to hear, but a very humbling, experience, eye-opener for me. And so what I did is I started looking into RN programs, but the RN program list was 2 years long, and I'm like, okay, you know what? I would really love to do that, but what else can I do? What else can benefit me? And so, I did, decide to apply to the business, program and start to learn more on business and business operations. So once I did that, I was actually afforded, the ability to compete for some of those managerial positions that I would not, have had access to otherwise. And my journey, has been amazing at Cigna. I did lead, a section for the Alabama market, specific to independent physician associations. I then went from that Alabama market to Tennessee, and then from Tennessee to Texas. And so, I've been afforded the opportunity to manage and have oversight of 8 different states while working for Cigna. But about, 10 months ago, again, that weariness that I mentioned a few moments ago kind of set in. And I was like, all right, what else can I do? what else, is out there in Cigna. And so I did, apply for this operations position and was graciously, offered the position. It is very much, it is very different. We're used to, as nurses, being able to, connect with our patients, put our hands on people, make clinical decisions, that, benefit people. But, in operations, I am still making, very important decisions. But these decisions really have to do more so with value-based care and how to improve our healthcare, overall. And so, a day in the life, of operations is really a ton of meetings where we will sit down with multiple stakeholders and discuss, the business aspects, but as we're discussing that business, we also keep the clinical in mind and make sure that as we make those decisions, we're also making decisions that clinically benefit and add value and, can ultimately lead to enhanced quality of care for, our overall health population. And so what I'd like to share with the nurses and those of you that are listening is that nursing is one of the absolutely most versatile professions that there is. And, as evidenced by the wonderful panel that we have here today, there are nurse educators, there are nurse practitioners, there are med-surg and pediatric nurses, but there are also these operations nurses that sit behind the scenes and help to, push changes and promote changes for healthcare. You will most definitely need a minimum of like a bachelor's degree to be competitive in this business. And also the ability to effectively communicate, multitask, and critically think. So those are some of the aspects that you will need to be successful in this particular role. So I am thrilled, absolutely thrilled to be, on this panel and talking to you all today. So, consider operations as you continue to build on your educational journey.
Thank you for that. And I loved how you mentioned that you felt that not being clinically at the bedside with nurses wouldn't look, with the patients wouldn't look the same to you now that you were behind the scenes, but you're still providing decisions that affect the clinical care of these patients. And you're still a nurse, right? Just because we're not touching patients every day does not mean that we are no less a nurse. And I love the fact that you're representing for the LVNs out there. Thank you so much for sharing your story. I appreciate that. So next, I would like to talk with Dr. F. Diane Barber. Are you here, Dr. Barber?
I am. Thank you, Tiffany. How are you?
Good. So I'm gonna introduce you and read your amazing bio really quickly before we get started because it's very impressive. Dr. Barber is a manager of advanced practice providers at the University of Texas MD Anderson Cancer. She earned her BS in nursing from the University of Hawaii and Manoa and an MSN from the University of Pennsylvania and a PhD from the University of Texas at Tyler. And I would love for you to talk about clinical trials researching, Dr. Barber. And I love that your academic career has a little bit of everywhere. I think you kind of hit almost all four corners of the United States with that. Well, that's great.
I did. And I had the fortunate experience of being married to a military man and going to school at the various places that we were stationed at. So I actually started out, I guess, as a nursing assistant, as similar to Marcia, and I went for my associate's degree, then I went for my bachelor's degree, and then one day I decided I wanted to be a part of the medical decision-making of taking care of patients. So I then decided to go for my nurse practitioner at the University of Pennsylvania. And then I think I probably had about 33 years of nursing right now, and I spent probably about 10 years as a staff nurse. Being a charge nurse and a clinical leader. And then I moved to Texas, where I started at MD Anderson Cancer Center, where I started in bioimmunotherapy, then multiple myeloma. And then for the last 13 years, I've been in clinical research. And so I wear three hats there. Number one, I'm a manager of advanced practice providers. I manage about 16 advanced practice providers. That includes nurse practitioners and physician assistants. And also I'm a active nurse practitioner in the practice in that I have 3 clinic days. 2 of those days I manage patients with a physician. And one of those days I actually independently see patients. And so that career path, I would say, is an interesting and a unique career path for a nurse practitioner in that you're called a clinical research nurse practitioner or a sub-investigator. And what that means is that your daily activity is centered around screening patients for clinical trials. So you, as a nurse practitioner, you get the information about a patient. And I work particularly in phase 1, which is the beginning of a novel agent becoming a FDA-approved drug. So what you do is you screen patients to see if their kidney function, if their CBCs, or if their past medical history is acceptable, eligible for a clinical trial. Then once you have decided that, you see the patient in the clinic and you do, a physical exam assessment and look at their diagnostic testing and see if they meet the eligibility to participate in a clinical trial. And then once they go on the trial, you as a nurse practitioner, you're there to assess any adverse events or side effects related to the trial and also do symptom management regarding that. So that's the major function as the clinical research nurse practitioner. And then because I have a PhD, I also do my own research. And that focuses on the outcomes of patients participating in early phase clinical trials that are seen by the advanced practice providers. I want to see how do we make a difference in patients' lives and improving their quality of life.
I like that. So specifically with the APP and not with the physician.
Yeah, so
right,
correct. I want to, because we do know some of the outcomes of physicians and patients with cancer, but we don't know a lot about the advanced practice provider and the patient outcome. So I'm looking specifically at that.
Yes, and hopefully that continues to validate the need and the importance for advanced, for APPs, specifically nurse practitioners.
That's my goal.
Yes, because lately what I'm also seeing, so I'm on social media a lot, everyone, at New Nurse Academy on Instagram and LinkedIn and Facebook. And right now, that is where the current generation is getting their news firsthand. And one of the conversations that is popping up on social media is I guess this discussion again between physicians and APPs, specifically nurse practitioners, and the value that the nurse practitioner brings. And so if there's anyone who's here who's a part of Twitter, specifically nurse Twitter, right? There's a section of Twitter, the Twitter world called nurse Twitter. This conversation comes up often where we're seeing physicians tweeting about, or invalidating, I should say, nurse practitioners. And it feels like a constant fight to say, I am worthy, I am here. So I love that you're doing this work specifically to show the outcomes with APPs. That continues to validate the need to have APPs in the healthcare world. So thank you so much, Dr. Barber.
Thank you.
For sharing. Appreciate that. Okay, so next, Miss Kenicia, not Miss, Dr. Kenicia Adams Strong. Hello.
Hi, how are you?
How are you? Happy Saturday. So I would love to read your bio before you start talking about being a CRNA, okay? So Dr. Kenicia Adams Strong graduated from Wayne State University in 2007 with her Bachelor's of Science degree in psychology. And in 2009, she entered and graduated with honors from the second degree option Bachelor of Nursing program at the University of Detroit Mercy. For 3 years, she worked as a registered nurse in emergency, step down in intensive care units in Detroit and Toledo, Ohio. In 2012, she was accepted to St. Vincent College Excella Health School of Anesthesia in Latrobe, Pennsylvania. And upon graduation in 2014, she obtained employment as a staff CRNA at St. John Providence Hospital in Southfield, Michigan, where she worked until accepting a position at Henry Ford Macomb Hospital Nashville in 2017. So welcome, and looking forward to hearing you talk about your role as a CRNA and what that means, because this is also a new hot trend in social media where everybody wants to be a CRNA because the money, right? That's a conversation that I hear, that this is the position that nurses go to make bank. So can you talk to us a little bit about your journey and your current role?
So I began my journey thinking that I wanted to be an anesthesiologist. Both of my parents were nurses, so that's definitely what I didn't want to do, or so I thought. I wanted to be at the bedside. I wanted to put my patients to sleep. I wanted to take care of them minute to minute, second to second. So my parents encouraged me to shadow a CRNA. And I quickly realized that that's actually what I wanted to do. But like many people, I didn't realize that it wasn't the anesthesiologist that was at the bedside with the patients. It was actually a nurse. I didn't realize that nurses had that type of autonomy. I remember being in the ICU thinking all those years, like, if I could just get this, then my patient would get better. Or my experiences teach me that if I could just have an order for this, and now I'm at the bedside and able to do that. And that's what really, steered me towards anesthesia, being able to critically think, use the knowledge that I've learned in the classroom, and also working in the intensive care units, ERs. I'm able to draw from all those experiences and take care of one patient all the time. And I love that. I feel that my knowledge is appreciated, it's respected. I mean, there's so many CRNAs, 53,000 of us working in the continental United States, providing anesthetics every single day in so many care environments. I currently work in a tertiary care environment. I work in a hospital, but also a surgery center, endoscopy centers. We're in labor and delivery units, doing epidurals and spinals for cesarean sections. We're in offices of doctors doing, small procedures, dental offices. We're at every code blue. Whenever somebody comes calling, here we are. So I just love the fact that my job changes every day. I don't get comfortable. I don't get complacent. It's a humbling job. Just when you think you've got it all figured out, something throws a curveball at you and you're reminded that you're still a student every day. You're still learning. There's still somebody who's going to just surprise you with the way that they react to a medication or something like that. So I love that part about being a CRNA. Every day I go in, my job is different. Every day I go in, I enjoy being where I am. I was an ER nurse first, an ICU nurse next, and I feel like every day I'm still a nurse. And I think for me, that's very important. I have that hand on my patients. I have, I'm watching the ventilator, but I'm also watching everything else. And I'm able to make decisions based on things as they change. And for me, being able to focus on that, that's what fits my personality. We're not just behind a drape. We're not just, invisible as many people think. I don't find it boring, but some people do. But that's what the beauty of nursing. You can find something that is tailored so perfectly toward who you are. And for me, that's being a CRNA.
Absolutely. And thank you for bringing up the point that it's the nurse that is with the patient, and that the physician comes in, but it's the nurse that stays. So thank you for bringing that up. And even in your advanced practice role as a CRNA, you were still providing direct patient care and can be independent with that as well. And I know in certain states, there's some nuances regarding that for all APPs, to be honest. But I love that you mentioned that, that you were able to shadow, which I think is really important too, when you are looking about what you want to do in life. So you have the opportunity to experience it for a little bit to see if you like it before you invest your time, your money, and your energy. So that was good that you were able to shadow and then confirm your decision-making with that. Absolutely. So how was CRNA school?
So CRNA school, the process of applying is very competitive. I mean, I know that you said the trend seems to be that everybody wants to be a CRNA, but the truth is there aren't many people that get in, and that's the hard part. I mean, schools receive hundreds and hundreds of applications a year, and most classes are anywhere from 10 to 30 being on the high end. Yeah. So, you're focusing on your sciences, your math, very important. Your GPA is so important. A lot of people retake classes. I know I did. My classes were, borderline, B-. I went back, took the same class to get an A. You're taking graduate level courses to prove that you're able to do that type of work and to do it in a short time frame. I mean, we're talking about for the master's programs, most of them are 24 to 27 months. And that's a program that I did first and then went back for my doctorate. So my trajectory was a little different because I then had to spend another 27 months getting my doctorate degree. But now it's an entry level doctorate for most of our programs, and they'll transition completely by 2022 or 2025. So these students are going to enter the program and won't graduate for 36 to 39 months. So you're getting a doctorate in that time frame. So you're working on your doctorate work, your capstone project, but you're also still getting all of that patho and organic chem and pharmacology. So it's the process of being in school is really, it's hard. It's not hard because you're being a student again, because a lot of us are still there. I mean, for me, it hadn't been that long since I graduated, but your time is not your own. Not only are you in the classroom, you're in the operating room. And when you arrive there for clinical, it's not like in nursing school where you knew you were going to be there from 7 to 3 or 7 to 11. I would get there at 4:30 in the morning. You're the first person in the door and you're the last person out, because you don't want to seem like you're not interested. You want people to think that you're ready to learn. You want your room to be ready so that when your mentor or preceptor for the day arrives, they have nothing to do. But if they see a case that comes in as you're about to leave, guess what? You're staying. And sometimes that's 8 hours, that's 16 hours, and sometimes it's 24 hours. You have no idea when you're walking out of the door, but it's because there's experiences that you need to have while you're there. Because some things you just can't plan. An open AAA or a quadruple bypass patient that comes in, you don't want to miss those times because you're going to be on your own in a very short time. So you want to make the most of your clinical experiences.
Absolutely. Dedication and hard work is definitely what it takes. And yes, school is hard. Nursing school is hard. Being a nurse is hard. And so like I tell my clients and my students, choose your hard, because really, if you want to be a nurse, no matter what aspect you're in, it's going to be some level of difficulty in there. So thank you so much for sharing your story. Next, I would love to talk to my favorite nurse, Dr. Scharmaine Lawson. She's my favorite nurse for multiple reasons.
I'm your favorite?
Yeah.
Oh, no.
But let me tell you why you're my favorite. And I don't, again, at an NBNA conference, and this was the conference when we were in Tennessee. So I want to say it was in 2016. And why I remember this specifically is because my mom and my daughter came, and my daughter was 2 years old. And we were walking through the vendor hall, and you were sitting at your table, and you had NOLA the Nurse books. And my daughter was reaching for a book. And I remember you signed it, and I still have it, still have a signed copy. And now we have the series, and we have the coloring book, and my daughter walks around with my lab coat and my stethoscope on. Nobody talks about Doc McStuffins anymore. She talks about NOLA the Nurse. And so that is why you are my favorite. So hello, Dr. Scharmaine Lawson. Let me read your fabulous bio before we get into it. So Dr. Scharmaine Lawson was featured on CBS Evening News with Katie Couric, ABC, NBC, and Johnson & Johnson. Dr. Scharmaine Lawson is a nationally recognized and award-winning nurse practitioner in New Orleans. She is a fellow of the American Association of Nurse Practitioners and fellow of the American Academy of Nursing. She continues her private practice today, but still manages to find time to write and produce her NOLA the Nurse series of stories and activity books. And I saw on Instagram that you may be coming to TV. I'm so excited about that. Again, me being on Instagram, right? And I love that that NOLA the Nurse and that whole series focuses on STEM and the fields of STEM for boys and girls of all ages. I would love for you to talk about your journey in nursing and what you're currently doing in NOLA the Nurse. But first, I have to ask you this. So I stalk you on Instagram. And last year, as the world was closing and coronavirus was spreading and people were panicking, you packed up your bags and flew from New Orleans to New York, which was the epicenter of coronavirus. And you decided to put yourself out there to go back to the bedside, and you didn't have to do that. And I literally was like, literally, I said, this lady told her kids, Mom will be right back, and packed up her stuff to go into the fire to work. And if that's not dedication, I don't know what is. So please, can you tell us about your decision-making with that and what that experience was like?
Yeah, sure. Well, first of all, thank you, NBNA, for having me. And Tiffany, it's always a pleasure. I didn't know your favorite. Okay, we'll start there. We'll start with my trip to New York. that was nothing that I just woke up and said, "Oh, I want to go to New York. I want to, take care of Corona. I want to fight Corona." I didn't do that. It was just sort of one of those things where as you get opportunities and you have to decide, weigh it and decide if it's something you want to do. And so when the opportunity came for me to go to Bellevue Hospital in New York, I said, well, this is a different kind of danger because, coronavirus is something you can't see. You can't see a virus, right? But I felt a tugging on my heart because when we were totally sidelined by Hurricane Katrina years ago, we had several nurses who came to town to help, and we wouldn't have, I know I wouldn't have made it without the help. So when coronavirus came and the opportunity came for me to give back, if you will, I, you know what, if there's a way that I can do it, if there's a way I can rearrange things with childcare, now I have children, let me see if I can do it. And so the opportunity came, and I was able to safely arrange for childcare and safely make that trip to New York. And I was able to do it actually twice. Not the second time wasn't New York. The second time was actually in Texas. So the spirit has always been in me to give back to the community, obviously with my trajectory of working and helping here in NOLA. But overall, my willingness to travel and do something outside of the box, color outside of the lines. I was never one to say, oh, okay, if my teacher was to tell me, say, color all the boxes red. Well, one of them had to be blue, so I just, I was always willing to just kind of push it just a little bit, and of course safely, and come up with, if same if not better outcomes. So that's what really drove me to take on the New York travel COVID crisis mission trip, if you will, and also the second one in Texas.
Absolutely. And I love that. So it was your way to give back because nurses came to you in your time of need with Katrina. So can you tell us about what was birthed though out of Hurricane Katrina for you professionally? I know your story, but a
Yeah,
lot of people
yeah.
on here don't.
All right. So I got to take you back though to how it all began. I didn't initially want to be a nurse. I didn't grow up saying I want to be a nurse. I didn't, there were no cartoons, of course, about nursing or even Doc McStuffins back then. So I just said, I always wanted to play music and realized very quickly that music wasn't gonna pay any bills for me or my grandmother at the time who raised me. So I joined a CNA, program in high school, and it gave me a chance to early on find out if I was even interested in nursing. I knew I liked science, but wasn't sure if I would like nursing because it's more than liking people, right? You have to like the bad side of people and the vulnerable sides of people, which are not sometimes pretty or friendly. So being a CNA taught me early on that I think I'm okay. I think I'm okay with getting to know people at their most vulnerable states. And I was so thankful that I became a CNA right after high school and was able to start working there because that then just sort of set a fire within me to know that I think I want to go further. And so that's when I enrolled, got accepted into Dillard University. Yay, Blue Devils. And just kind of started my whole nursing career. I got my BSN from there, and like most nurses, we don't stop. We just keep on going. And so I became a travel nurse after that, traveled to the East Coast. Then I said, you know what? I think I want to be, I don't know, I think I want to be a CRNA. But first, I still think I want to be a musician. So I moved to Nashville, and let's just say, honey, never forget your day job. Okay. So my day job sustained me. I was I traveled to Nashville and was a level 1 trauma nurse, ICU ER, because like some of you other colleagues, I thought I wanted to do CRNA. I just knew it. I was as hell bent since music didn't, pan out. I said, well, CRNA is it. That's what I want to do. Well, the important thing about shadowing, I said, before I just break on down and go ahead into this program, let me shadow an NP. So I shadowed an NP, and lo and behold, I said, I love it. oh my goodness, I have the freedom. I can just kind of do what I want to do. I can travel and do all these things, and at the same time still provide primary care. I loved the marginalized community I was working in. It was FQHC, Federally Qualified Healthcare Center, and I just love the experience. And so I went back to work on that trauma unit and said, I'll be here for a little bit, but look, I know I changed my desire from CRNA to NP. Then did that, and then finally said, like everybody else, I think I want to teach in academia. And in order to do that, you have to have a doctorate. And so I was so glad that the clinical doctorate came out, got my DNP back in 2008, and said, you know what? That's it. I'm done with school. But here I am again, finishing up like most nurses do. We can't stop finishing up my psych mental health NP certification because I wanted to add that critical component to my primary care practice, because I was finding that, as you all know, I know I'm preaching to the choir on this one, but most of my patients are having to wait for behavioral health care services for 3 to 6 months. So it's falling on me as an FNP to prescribe psychotropics that I just wasn't comfortable doing. So I said, let me just go back and get yet another layer here of a certification so I can be better prepared to serve my community. So I'll be done, praise God in heaven, next month.
Yeah.
Actually, this month, the 29th. Hello, we're in April. Hello, this month. Yeah, I'm done with clinicals.
That's
Now
amazing.
we've moved into board review and board certification preparation now.
That's amazing. Yes, so nurses are perpetual students. There's always something to learn and add. Even outside of the scope of clinical nursing, there's always something to add, like an MBA or, another certification.
Yeah.
And I love how, as a nurse practitioner, you're thinking holistically of your patient and not saying, well, this is all I do.
Right,
You
right.
have to go somewhere else for this, but you're going to say, I'm going to be a one-stop shop.
Yeah.
And so I am going to give you everything that you need to let me get myself prepared for that.
Mhm.
Yes. So I do see a question in the chat that asks about travel nursing. Can you expand on travel nursing and what that is?
Sure. So my first bout with travel nursing was back in, I don't want to age myself, let's just say when I first became a nurse, sometime there in the 90s. All right. I said, you know what? I want to get out of New Orleans. I want to just travel. And so I logged on and signed on with a travel agency because I wanted to just go to different states and work within my specialty. When I first started was CCU, ICU. So I wanted to travel as an ICU nurse or ER. So I worked for about a year and built up all of my experiences in ICUs and got certifications and that sort of thing. And then signed on what was then American Mobile. I think they're still out now, and or Cross Country. I signed on with two. And they ask you what region you want to go to. And I wanted to go to the East Coast. So I traveled to Baltimore, and they give you an apartment. They give you usually a higher rate of pay, and you don't have to pay anything. They paid for my travel and lodging there, and it was a 6-month assignment because I said, well, I'll be new to the area. My grandmother traveled with me. She was 86, and we traveled together. We were a team, and we moved to Baltimore, packed up everything and moved there. And it was, for me at the time, I was thinking, I want to just stay here for 6 months and then maybe move. We'll go somewhere else, just, explore the US. Listen, I stayed in DC for 6 years.
Wow.
For 6 years. And I kept taking different assignments, but still remaining in that area for 6 years until she passed. And then that's when she passed away, I took another travel assignment to Nashville. You just sort of decide where you want, based on what you want to do. And for me, still want to be a musician. So I said, I'm traveling to Nashville because that's where musicians go, right? Thankfully, I kept my day job. So I traveled there. And so that's how I was able to see the world and also at the same time follow some of my passions. So nursing allows you to do that. It gives you the diversity of career choices, but also the reinforcement and revenue to follow some of your passions.
Absolutely. That's great. And of course, right now, travel nursing is the big thing because hospitals Definitely need staffing. Nursing, as an industry, was already short staffed. We already knew that, right? There was already anticipated projection that the baby boomers were going to be retiring, and so we were going to have a deficit in staff. And then this pandemic opened a lot of people's eyes for various reasons, and so nurses are either leaving their home job to travel, to get the opportunity to go different places to help out, to get the opportunity to travel the world, to get the opportunity to make up to $10,000 a week, which 2020 was the year of the nurse, and the nurse made that money. Okay.
And they still are.
Yes, they very much still are. And so travel nursing is a way for you to see a lot, do a lot, learn a lot, make a lot, and not have a commitment to that. So I love that you experienced that with your grandma. That's a wonderful. That's actually that's great. So I love that. So what are you doing right now in your role? I know that you are known in Louisiana, especially in New Orleans, for doing door-to-door concierge nursing. Can you tell us a little bit about that?
Sure. So I have had my house call practice, which is providing primary care in the homes, since 2004. And it was going strong for a long time, but I was beginning to just kind of look around and say, do I still want to do this? Just because after a while, you just want to do something a little different, because I was and still am simultaneously running the house call course, which is teaching other clinicians on how to start a house call practice. So I said, well, I think, after about 15 years, you become an expert on something. So maybe I should focus more on now, doing more public speaking and writing more books about house calls. So I was already leaning towards maybe doing more writing and speaking. Then when Corona hit, that just sort of made the pivot a little easier for me to transition pretty much, I'd say maybe 78 to 80% of the patients to a telemedicine platform. And that's where that practice is. Well, all of you out there, if you don't know, when you switch a entire practice to a telemedicine platform, there's a reduction in revenue because the reimbursements are different for telemedicine. So I had to then decide, well, not many speaking engagements going on now because of Corona, because I had been doing speaking engagements, flying here, flying there, and doing this. Well, all that, abruptly stopped because nobody knew what to do. So that revenue from public speaking stopped as well. So at the same time, a local clinic contacted me here and they said, well, we're looking for a medical director. Would you consider being a medical director for us, even if it's, part-time, or just let us know what you want to do? So this local clinic was actually a clinic where my collaborating physician worked, and she was no longer there. And so I assumed her role as medical director at Hope Community Clinic. I've been there since August of last year, and I'm there about 3 days a week. And it's a wonderful little clinic, and we supply and perform what we call rape kits, or where victims have been sexually assaulted. We do the rape kits and the SANE exams. We have a SANE nurse on staff, and we have a large behavioral health unit that works with the forensic teams from the NOPD, whereas we go after perps, and just the whole thing involved with domestic violence and victims of traumatic strangulation. So that's been very rewarding to me because I'm able to just provide different services and just kind of have a different way of helping a totally different population of patients. And it's been really, really rewarding that they work with me in my schedule and say, well, just tell us the days you want to be here. We really just, really need your leadership for us, and just, because you're known in community. And it's just such a blessing that I'm able to do that, run Nola the nurse, and work on cartoons, and take care of babies, and also make time to get my nails done. So it's a blessing, and I thank God literally every day. You probably see my posts where I'm just like about to cry, because it's really a very rewarding time for me.
Wow, thank you for all of that. I did not know about that, about your new clinic and the focus of that new clinic, which is a little bit horrific to hear that there needs to be a clinic that focuses on that work. So that's a little bit of that's sadness. However, the fact that there are people, professional experts in the field that can dedicate their time and their resources to that is also a blessing as well.
Yeah.
So thank you so much, Dr. Scharmaine Lawson. And so that was a little bit of all of our panelists, everyone. And I am going to go back around and ask them a few questions. However, in the meantime, if you have a specific question that you would like to ask one of the panelists, please put that in the chat and I will ask them that for you. I see someone, Natalie Wilcox, says, Dr. Lawson, do you offer any master classes or have any books on starting a concierge nursing business?
So my house call course, it's called the house call course. I've been doing that since 2008, and I do now offer webinars on, how to start a house call practice. But it's when you take the course, the live course, which we really haven't been live now in about a year. But of course, thank you, Rona. So, the course is not just for house calls, it's for any practice. So that could be concierge, it could be even a traditional clinic. If you're wanting to start a private practice, then I offer those tips and pearls on how to do that. We're now redeveloping the website, so we'll give you more insight on to when the live courses will begin again. But for now, the webinars are available, and I also offer one-on-one pick your brain sessions as well. So yeah.
Thank you. So I'm going to go around and call out some of the panelists and ask them a specific question about their role. So Dr. Shinholster, I'm going to ask you, what do you find most enjoyable about your job?
Get myself off of mute there. So the most enjoyable aspect of my job is the people. The Care Allies organization has some of the most talented and amazing individuals I've ever worked with. I even enjoy the interactions that aren't always positive, right? Working with my colleagues, to launch products and benefit the org, and the people we serve is just an overall amazing feeling. So absolutely the people.
That's great. That's great. There's a question in the chat from Candace, and I'm going to direct this to Dr. Dawson. Candace says, I'm currently a student getting my BSN and wanted to know how long of a break do you all recommend before jumping back into school to further your nursing career? Thank you.
I'm not sure why you would ask me that question because I'm very old school. And one of the things that is really concerning me at this time is that so many of the schools are really pushing their new graduates to turn right around and re-enter and start working on their master's or their BSN to DNP or their BSN to PhD. What you have to ask yourself is, at that stage in your career, you heard many of us speak this afternoon and say we started out with one mindset, but then we took a detour once we really realized what it is that we wanted to do. And I see so many new grads that have been encouraged to go right back to school. And even some that are just finished, still in orientation, and they're applying for their master's or BSN to DNP or BSN to PhD program. And what concerns me about that is that it takes time for you to understand nursing practice. You've been in school for a period of time, but what you were learning in school was the basics. Just like we tell you with the NCLEX. The NCLEX does not test your expertise, only your lowest level of competency. And what I find many times is people will start off and then midway through they say, this is not what I want to do. And sometimes they may have already completed the entire degree and then decide that's not what they want to do. So I say I love to encourage people, give yourself at least a year to learn your job, then give yourself another 6 months to start testing the water. Because you may start out in cardiovascular ICU and then decide, but I don't like this as much. So then you want to go into the mother-baby environment or something else. So I just tell you, take your time, and hope I don't have anyone who's going to report to my dean on me. But remember, they're in the business of revenue generation. Okay, so your career, you have to own it yourself. You have to know when you're ready. You have to decide what it is that you want to do. And then you have to make a choice about what school do you want to go to. You may not necessarily want to return to your same school, because you may want to learn something different or see something different or go somewhere else. And then you also want to learn something about the funding, because some places will fund your education for you. And I am encouraging young people. Yes, I want to encourage you while you're young, go ahead and get your doctorate degree, but do it at a time when you understand where you want to put your energy.
And that's why I asked you that specifically, because as a millennial, and I put myself in quotes, I know my age, I put myself in quotes, I feel the same way. As a nurse educator, I dissuade nurses from coming out of undergrad and going right back into graduate school without knowing what it is to be a nurse. How can you be a nurse practitioner and be a provider when you haven't even seen half the things that you're going to be prescribing for or treating yourself? You haven't done that as a nurse. So I feel the same way. And I had a feeling that you and I had the same mindset when it came to that. And so that's why I picked you. I am very new school in a lot of things, but when it comes to education and building your foundation, I'm still very old school with that. And so I do feel like there needs to be a solid foundation there. You need to understand your career, find your passion, and then develop that as you continue up the ladder. So yes, thank you so much. There's a question. Go ahead.
And we've lost a lot of new nurses just because of that, because they go back to school and then they find that they can't get the position that they want, or they get that position and they're totally frustrated because people are expecting them to perform at a certain level and they are unable to deliver. And so when I see nurses that have their masters and they're still at the bedside and they're frustrated because they're there, my first question is, how long did you work as a nurse prior to going back to get your master's? So that's very important to have that foundation.
Yes, thank you. There's another question in the chat that says, do any of the panelists have information about starting nursing consultation services? So Michelle Carter-Bay, thank you so much for that question. I am going to ask specifically, what kind of nursing consultation? I have a nursing consultation service, New Nurse Academy, but it focuses on staff development and education. And there's so many different aspects of nursing that one who is an expert can consult on. So first I want to say, are you an expert in the field, and have you produced any results and outcomes? Because in order for you to be a consultant, you need to know exactly what you're doing and everything about your industry and fields, upways, sideways, upside down, so that you can then consult someone else on it and help them with the transformation that they're looking for to get them to the outcome and the results that they need. So that's first and foremost. The other thing that's out in social media is get your stimulus check, get your stimmy, your $1,400, and start an LLC and start a business, and then triple that money. And then next thing you know, you're going to invest it and you're going to have this big old house. And that's what they say in social media, but they don't tell you the behind the scenes of what it takes to actually start a business, right? So I want to throw that back out there to the panelists. Aside from actually being an expert and actually having results and outcomes and knowing what you're doing, what else does one need to start a nursing consultation service?
Well, I've had my own consultation service. So one of the things you need to be able to do is build up a clientele. And you have to know, again, what are going to be your specialty? What's your expertise? What are the market looking for at this time? What will they purchase? Because what you have to understand when you're talking about a consultative service, you are a business, okay? And you have to then meet the client's need, not so much your needs. So it sounds really good, kind of, seeing out there, I'm a consultant. But you have to remember, you have to be able to deliver. And the other thing is you also have to know something about finance. and laws and those type of things, because you're going to now be responsible for your taxes, you know, and you have to understand, so what does your state say about being a consultant versus what another state may say? And some states, when you're a consultant, if you're not doing your consulting business within the state, but you're primarily outside, you do not have to pay state taxes, but you still have to pay federal taxes. You need to know how to market yourself. You need to know how to network, build relationships, but then you also need to know how to manage money. Because when you're a consultant, you never know when that dry spirit is going to come about. The same as with what we was hearing from Dr. Lawson with the coronavirus. You're doing good all of a sudden and something hit, you need to have a backup plan. Whether that backup plan is you're still doing something on the side, or you know how to save well enough so that you can go between the next assignment. And then you also have to be able to, when you're building those relationships, you have to be able to continue to tune yourself to the market. So if what I'm an expert in, if the market isn't asking for that skill set, then I have to go back and develop the skill set, the tools, and the things that I need that the market is asking for.
Thank you. Anyone else want to add to that? What does it take to start a nursing consultant service? Okay. I do have another question that says, to the academia panelists, I have found that our local nursing school too still lack racial diversity on their admissions committee. Seemingly more EMT students are in the programs transitioning to the RN program. How might we either prepare our pre-nursing students better or influence the schools of nursing admissions committees? And I'm putting that out there to anyone who is currently in academia.
Okay, I don't want to do all the talking, but I will take that one. And again, I would just declare I'm old school. When you find a problem and you find a gap, you yourself first fill it.
Yeah.
So we know that we have a problem with diversity in nursing schools as well as with practice. So that's why I would encourage you to consider becoming a professor. Consider becoming a faculty member, you know, because the reason you see not that many on the admission committee is because you don't even have that many in nursing school. You know, it took me into my doctoral program before I even had an African-American faculty member. So sometimes we have to be ready to move into that space to fill that gap. So, because we definitely need more diversity within nursing, not just in academia. But since we know that is the front door to the profession, we have to get more of us into academia so we can open the back door so we can enter into the practice area. So I think, again, for those individuals that are baby boomers, that's why I'm saying if you can get your DNP, your PhD towards the latter part of your career and then start teaching, excellent. We need that. Or if you can just, you have your master's already and you can become a clinical professor. You know, so we have to get more of us into the education arm before we can actually begin to change some of those policies and procedures and practices that we see.
Thank you, Dr. Dawson. Dr. Barber, I want to ask you this question. What is your nurse superpower?
I think my nurse superpower is being able to have empathy for my oncology patients that I currently work with that usually have about, I guess, less than 6 months to live, but yet I can make a difference in their lives.
I like that. Dr. Kenicia Adams-Strong, I'm going to ask you this question. What is your biggest career achievement?
I think my biggest career achievement speaks to what Dr. Dawson was talking about. My doctorate work was in increasing minority representation in advanced nursing specialties, especially anesthesia. I mean, there's 1% African Americans in anesthesia and 2% of CRNAs are Latino. So when I got into the role, I realized quickly that that was an issue that I wanted to focus on. And I was just grateful that I was able to do my doctoral work in that area. So I've been working with the task force here in Detroit, Michigan, where I am a resident and native, looking at the practices of admission, looking at who's applying. Why aren't we collecting data? Is it just that people are not applying, or is it that they're not creating profiles that are even worthy of an interview? And those are some of the things that we're looking at. And then if there are disparities, why do they exist? Is it related to socioeconomic status? Is it related to the fact that people just don't know what this profession is? Is it due to, local education systems not being up to par? All those things have to be considered. And is it related to the fact that there is no support for those students? Do they apply? Yes. Do they get in? Yes. But how do you stay there? I was the only African-American person in my program, and the only African-American person also in my doctorate program, in a place where in the clinical site, I was often the only African-American person in eyesight. So for me, socially and also emotionally, physically, there was support that I needed that I didn't have. So I know what that feels like. So I've been a mentor over the 6-7 years that I've been a CRNA. So my biggest accomplishment is a text message that I got, like when I get messages from mentees who have gained admission. For me, I made it, but it doesn't matter if you can't help other people as well. So when I get those messages saying, I got an interview, I got in, or thank you so much, this has been beneficial because now I am here in my life, that means I'm making a change in our profession. And that for me is my biggest accomplishment.
Absolutely. Dr. Marcia Lowe, I'm going to ask a question for you. Outside of med-surg, what other specialties within a hospital setting would you recommend a new grad nurse to apply?
I looked at that question. I was going to answer that. A lot of our new grads still go to women's health. That's a good place to start out as well, because you're still getting skills and still getting some of those bedside critical skills that you need. So we do hire new grads in OR, recovery room. I mean, when I was started out nursing, we did not hire new grads in the recovery room or in the OR. That was just the thing. You always start out in med-surg. So there are other areas. I'm not a fan of going straight to a clinic because you don't get the start IVs and put in Foleys and all that, the stuff that you need to do. But I do encourage people to do more than one thing. You can work med-surg on the side while you work your PACU. So you can do more than one thing. So it's just all where you are in your career and what you think you want to do.
Thank you for that. And also for any new nurses, if you can find a facility that has a residency program, that will help as well. The residency program is going to, for 12 months, they're going to help integrate you into the culture of nursing. They're going to support you with your clinical skills, but then also give you a mentor, which may not be the same as your preceptor, the person who's doing your orientation. And they're going to follow you by getting metrics, but then also with some qualitative things as well to help support you, because that first 12 months as a new nurse is important, and it's a lot. And nursing school does not prepare you all the time for that. So if you have a nurse residency program that you can apply to, that'll be helpful. And sometimes these nurse residency programs are also with their pathways into some of the specialties like ICU, labor and delivery, and the ER, where a lot of hospitals may not take a new grad nurse with no clinical experience at all into these subspecialties, but a lot of times the nurse residency program have a pathway into those areas to prep you. So that'll be that. So there is a question about how can one access the recording. I'm going to say that the NBNA will probably put out some sort of notification about where one can access this recording at the end. For those who are NBNA members, please check your email, because a survey went out not too long ago about your participation with this year's conference. NBNA is celebrating their 50th year. This is the 50th anniversary of the NBNA. I am a proud member and have been since 2016. I feel like every time I go to a conference, it is a pilgrimage. It feels like revival for me. It's like my nursing revival. And I love it to be in an area where there's so many prominent nurses, so many just Black nurses. And so please check your email to check the survey about your participation on this year's NBNA conference. It's going to be at the Anatole Hilton Hotel in Dallas, Texas, and so I'm excited about that. And the conference date is August 3rd through August 8th. The other thing is the NBNA is still doing scholarships for those members who are in school. So check your email for that about their student scholarship. The deadline for application is April 15th. And so Dr. Dawson, president of the NBNA, I would like to turn over closing remarks to you.
Okay, well, thank you first of all, Tiffany, for being here with us and moderating for us. And to all of the panelists, I do appreciate all of the excellent information that you have shared this afternoon. And to our national office staff, I do also appreciate you setting this up and getting us started with this conversation. And I just want to say, all of those that are students out there, please remember to connect with us in terms of our Student Connect program. That is going to be fabulous. I would say that we just started it about 2 months ago, and they're already off and running. I mean, they have their video, they already have their logo, they're already sending out questionnaires. So these young people, they're ready. They're shaking and moving. And then to my experienced colleagues, thank all of the members and the board members that I've seen on in the chat and seen your pictures here this afternoon. So appreciate you being here to support us. And as Tiffany just stated, we need for you to join us in Dallas, Texas. If you have not attended one of our conferences, you are missing a treat because that is where you have the networking. That's where you can get what we call mentorship in the moment. You can get your questions answered. And also you will make lifetime friends, lifelong friends for life. People that you can reach out to, people that you can talk to. And again, we posted our email into the chat box for you. Please feel free to reach out to us. We're not just putting it there just to say, okay, you asked for it, so here it is. I really do expect to hear from some of you that I've been keeping up with in the chat. If you saw my eyes kind of moving about, and I've been writing down some emails addresses as well. So if some of you don't reach out to me, trust me, I will reach out to you. We are just doing so many great things here at NBNA, and we're just so excited about where we're going. And you've heard from so many of our outstanding members this afternoon. And trust me, we have 4,000 more. This was just the tip of the iceberg. So thank you again for being here. And again, Tiffany, thank you so much. And I wish you much success with your, I think is what, Tiff Talk Show?
Yes, so thank you so much. This is what happens when you leap out on faith. I am working with Charismatic Brands, which is the umbrella parent company of Cherokee Uniforms, which a lot of nurses know and wear. They also are the owners of I Heart Scrubs and Dickies uniform as well. And every Tuesday, I do a talk series on their Instagram called Tiff Talk Tuesdays. So you can find me on Instagram, where I spend a lot of my time shaking stuff up in nursing on New Nurse Academies, where you can find me. And on Tuesdays, at 6 p.m. Eastern Standard Time, I do Tiff Talk Tuesdays. In February, I spoke to 4 members of the National Black Nurses Association for our Black History Month series. In March, I spoke with 4 more members of the National Black Nurses Association for Women's History Month. And for April, we'll be collaborating with the Daisy Foundation, and Dr. Dawson is going to be one of my guests on Tiff Talks, and I'm looking forward to that. So thank you, everybody, for spending your Saturday afternoon with us. Have a great holy weekend. Be safe, and hope to see you all in Dallas. Take care and be safe. Bye.
Okay, bye-bye.
Good afternoon.
Thank you, everyone.
Okay.